Hello, this is Beyond the Fold, an opportunity to go beyond the pages of West Michigan Woman and tell the story behind the story. I'm Lauren Eisenlohr, Marketing Director for Serendipity Media and West Michigan Woman. Today, I'm joined by Dr. Tammy Born. Tammy was our cover star on the February-March 2020 issue just before the pandemic began to affect all of our lives. So we are thrilled to speak with Tammy again, knowing that she will provide us some incredible insight as the Chief Medical Officer and President of the Born Health Clinic. Thank you so much, Tammy. We really appreciate you talking to us again about all of this.
Thank you, Lauren. It's really fun to talk with you. Thanks for inviting me.
Of course, of course. So like I said, the last time that we talked to you, it was just before the pandemic really started to wreak havoc on us. At that time, as you see kind of this long-term effect coming.
I wish I could say that I saw it coming. I didn't think it would be treated like this. I didn't think it would be as deadly as it has been. So we've learned a lot. We've learned the hard way and a lot of things here, but no, I have to say I did not predict this well. I wish it would have turned out differently.
Absolutely. And I guess, one thing that the pandemic made a lot of us aware of is our own immunity, as opposed to, just get this shot, just try to stay away from people, what are we actually doing for the long term to boost our immunity? So I wanted to ask you, are you seeing an influx of people who are now more concerned about their health and well-being coming to you?
Absolutely. That has been maybe one of the bright spots. People are saying, wow, many people that made it through COVID are saying, okay, I made it through, but now I'm still feeling a little bit tired. What can I do? But some people still fearful of getting it. A lot of people fearful of getting the vaccines. And you are absolutely right that there is not enough focus on how do we just stay healthy. This is a virus. Obviously, it's still curable. Most people live through it and do well. But what do we need to be looking at to make sure we all live through it and do well with it? And there's so many things. Just getting this inflammation out of our bodies, or at least knowing how to handle it, knowing where your weak spots are. And of course, we talk about our diets and how important that is in improving our immune system, especially 70% of our immune system is in our intestines. It makes sense that what we put in them affects how well we feel and how well we do. So,
absolutely. And in the Born Clinic, you are an institution of preventative medicine. So these are exactly the types of things that you're looking at, is what can we do to make ourselves healthier and be healthier for the long term? Can you explain a little bit more about what preventative medicine is and what the Born Clinic provides?
Absolutely. So being preventive to me sometimes means being proactive. Okay. And so a lot of patients will come to me and say, hey, my dad had this and my mom had this. I don't want to get these things. How do I be aggressive and knowing what's happening in my body? And the tests that are available now are incredible. We have worked with labs all over the country to find, what nutritional deficiencies people have, what toxins people have, what gene combinations do you have that set you up for certain conditions and issues and diseases. And you can put this kind of puzzle together and not have to guess at it and not have to, just wait for something to happen. Our medicine, our system is set up as a wait and see approach. Let's wait and see what we get. And then we can, we have surgeries and medicines for you. But what if we all took a proactive approach and really learned where our weaknesses were and how we can make ourselves stronger? I just think this is just a perfect time in history to be talking about these things and help each patient know what's going on in their body so we can get better.
Absolutely. And I was telling you before we came on that it wasn't until I had my second baby that I really started to pay attention what I was putting into my body and how it was affecting me. And I have to tell you, just doing a little research and cutting out things here and there has made a world of difference in really trying to take a more holistic approach. Something I love about the Born Clinic is that you are very proactive. You are on the cutting edge of these innovative therapies that are helping people. Is there a particular type of therapy that you're doing that you're seeing really good results from?
Well, for the virus and for the just the effects of the virus on the body,
Mm-hmm.
yes, we have some nutritional IVs that we have had really good success with. Especially people who've had the virus or had a reaction from the vaccine that just don't feel well for weeks, even after that they've had this virus. There have been some really dramatic turnarounds in patients that come in and just get some IV nutrition. We have some other treatments that we use that we're using protocols from the International Ozone Society, and we're using some ozone treatments on patients, and it has been remarkable. Even one treatment can make a difference in someone's energy and just that pain and inflammation that they have in their bodies after an infection like that. Yeah, I've really seen great treatments, great results from our treatments. So it's really the IVs that have made the difference more than any one other like oral treatment or anything. So.
And I'm so happy you say that, because I'm not sure everybody's aware that that is an option. People may be a little bit leery of IVs, but I'm happy to hear you say that it has been so helpful, and people are feeling so much better afterwards.
Absolutely. And I guess we've been doing IVs. Well, I started practice 33 years ago, and I've been doing IVs ever since. And so we have some formulas that are tried and true. I really don't remember anyone having a negative reaction. And it's just vitamins, minerals, amino acids, just nutrients that are all useful in our bodies for certain aspects, especially for immune system and inflammation responses. And I'd be willing to bet that probably 75% of my patients that I check don't have adequate nutrition. And we can't really trust our intestines to absorb everything we need these days.
Right.
A lot of our foods are depleted of nutrients. There's additives that kind of steal our nutrients away. And we just don't have healthy intestines to be able to extract those nutrients from from the food anymore. So IVs can make a big difference here.
Yeah. And, talking about 75% of your patients, aren't healthy. I would argue it's really not, it's not their fault in a lot of ways,
Right.
And I say that to myself, because going to the grocery store, those healthy foods that provide the nutrients, A, they're not readily available everywhere.
Right.
And B, the education just isn't there, or the marketing is telling us something that's not true about particular foods. So, outside of the therapies and in everyday life for your patients, is there something that you tell all of your patients to do? Like, do this every day and you will feel so much better.
If there's one piece of advice that would help everyone feel better, I hate to say it because everyone's going to say, oh, I'm not going to go there. It's stay away from sugar. It's not something that they're doing to feel better. It's something that they're not doing to feel better. And it's so addicting. And it's in all of our foods, especially the processed foods. And I mean, it's good. Who doesn't like it, right?
Yes.
And it literally is addicting. So yes, maybe in this certain time, this time of in history in the world, staying away from foods that cause inflammation, I think it is key. And sugar always causes inflammation in our body. No one really handles it well. Our cells just don't like it. But I'm not saying you can never have, a piece of grandma's pie or a treat. I think there are some healthy sweets or some sweets that are healthier than others. But yeah, for the most part, if we can stay away from sugar and processed foods, we'd be a lot healthier, and we could handle more of what the world's going to throw at us. Because it's probably not the last virus that's going to be around. I think again, right, this is a sign that there are some people's immune systems are very weak, and they're going to have a burst reaction. I'm concerned for the future that we're not ready for these viruses that are stronger than us for some people.
Yeah, I actually just saw that on the news that the White House is already preparing for the next pandemic. Not in a sense of trying to scare everybody, but the reality is this very well could be something that we face again in our lifetimes, unfortunately. And I agree with you on the sugar front, especially in terms of the addiction piece of it. That is very real. When I tried to cut sugar from my diet, it was so hard. And I felt like I literally went through withdrawals for a time period. And I tell people now, I can't start eating a box of cookies because I will eat the whole thing. I do not have the willpower to stop at one. So
no, that tongue is very powerful. When it tastes that sugar, it just wants more and more and more. So
we had a question come in. How many grams of sugar should women be staying under on a daily basis?
So I still like that formula of 30% carb, 30% fat, and 40% protein in a diet. So look at your overall, percentage and what kind of diet you're eating. But the key with sugar is carbohydrates are all technically sugars, right?
Okay.
But some of them are healthier than others. Having a cookie isn't as healthy as having an apple. They probably maybe have the same number of grams of sugar or carbohydrate in them, but the benefits of the apple far outweigh the benefits of a cookie. So it's not maybe so much about the grams, it's about the kind of sugar. And it's all about putting it in the right proportion. Like I said, I don't think everyone has to stay 100% away from sugar all the time if they can handle it. But unless they're addicted like you, Lauren, then I think we should probably stay away. But
I accept it. I admit it. I'm working on it.
But I think we can have some people can handle some. We just have to be careful and not overpower our body's ability to handle it. Some people can handle it with less inflammation. Some people will have it be inflamed for a month after eating a cookie, and that's not worth it.
Right.
So everyone's a little different there.
Well, and that kind of leads me to my next question. I think a big topic of conversation amongst groups of women, especially as we get older, is weight, and trying to just be healthy, but also maintain a certain weight, not gain weight, lose weight if we, feel it's necessary. And it gets harder the older we get. Is there something that we should be watching out for, or other than the sugar, of course, what are some other things that women could be doing as they grow older to manage that?
So speaking from someone who is older and is in menopause, I can attest that it is harder. It's harder to stay in shape. It doesn't take much of being on vacation for a week and missing working out to lose practically everything you've worked for.
Yes.
Or so easy to gain 5 pounds, so hard to get it off. But it does just take vigilance. What I've found, I think, in the office more than anything, is that there isn't a one right answer for everyone. And what's been fun for me is trying to help people put their puzzle together, because there are some foods that could be perfectly healthy foods for most of us, but not for some people. If you have a sensitivity to chicken and you eat chicken and it causes inflammation, that inflammation makes you gain weight, makes you feel worse and bloated, and doesn't go through your intestines without causing inflammation. Well, it would be great for you to know that, but you may not be able to figure that out right away. You may be inflamed from it the next day and not really be able to associate it with the chicken that you ate, the day before. So there are blood tests available that kind of can pinpoint what foods you should and shouldn't be eating. I just use chicken as an example, but it it could be anything. I've had people sensitive to broccoli. It's like the healthiest food on the planet, but not for some people. So testing yourself individually and then looking at what the right diet is for you, to me, has been really helpful for me and my patients. Just knowing specifically, come in, figure out what it is you're missing, what it is your body is crying for. And then I think those things, they change as we age, and be willing to adapt to what you're learning about your body. And if we're healthy and we keep our threshold of much higher than our disease level, then we can handle some stresses in our body and in our lives. But once we hit that edge and we start having disease, then it's harder to bring it back.
Okay.
So the more we know at an earlier age, the more we know how to stay healthy, the easier it is to go through menopause and not have weight gain, not be inflamed, not be achy, not be tired all the time, sleep well, not have brain fog that can even come with inflammation of menopause. So there are good ways to be individualized about this.
And those sensitivity tests, that's something that you offer at the Born Clinic?
Yes, and very reasonably priced. You can test 100 foods all at one time for $100, less than $100. So again, it's not hard to figure these things out. We really tried to negotiate prices with labs all over the country so that we can figure out what it is that people need and what it is they're doing that could be hurting them that they didn't even know.
Oh my gosh, $100, that's really an investment in a lifetime.
Absolutely.
Information.
Yeah, if you can prevent one headache, it's worth $100. Or
absolutely,
that's what happened to me. I was getting headaches. I couldn't figure it out. I found out it was corn, but I didn't have the headache for 24 hours after I ate it. So I could never figure it out. Isn't that crazy?
Yes.
So that was just for me, but I can tell you many stories like that. It's really fun to kind of dig in and figure people out, and that's what I love, having people feel better, because then we feel better longer. If you can be 90 and get what your genes are programmed to give you instead of 50, then I feel that's a success.
In corn, I mean, of all things, I think most people think, well, I'm going to cut dairy or I'm going to cut red meat, but it's nice that you can get as specific as corn, to really realize what the issue is. That's incredible. So you help women learn, so much about their own bodies. I want to learn a little bit more about you. And in the magazine, you said that you love to sing, but maybe weren't blessed with, the most beautiful singing voice. I am the same. I always say I have the heart of a singer, but not the voice. That's okay. I'm just wondering, what song is it that you're belting out in your car or in the shower? What's your go-to?
So my mom always wanted me to play piano and organ in the church, right? That was her goal for me. I never was good enough for that. My favorite song to belt out would be Amazing Grace. I have seen just that grace so evident in my life in so many ways that's my go-to song.
That's fantastic. And you also said in the magazine that you love to travel, that you took a wonderful trip to Croatia and Greece with your husband. I don't know if you've traveled internationally at all since the pandemic. Just wondering, where is that next trip? What do you have your sights set on?
If I could go anywhere right now, we had a wonderful trip planned to the Far East. We were going to go to Singapore and Malaysia and just to that area. I've never been to those cultures, and I love the food, and so that's where I wanted to go. We had a nice trip planned, had to cancel it. So we went to the Bahamas a couple of weeks ago. That was wonderful, and we had great weather. So other than that, it's been pretty much stay close to home these days.
Sure. And you felt safe traveling and everything?
We did, yes.
Okay,
no problem. The hotels have been very, very helpful in keeping us safe.
Good. You also said in the magazine, sorry, I'm pinging back to all these personal facts that you gave us in February and March that are so great. You said that you, at some point, maybe want to write a book entailing all of the lessons that you've learned through the years. So I want to know, what is that first lesson that comes to mind?
Good question. I think it would be, as we talked about before, is just be proactive. Find out as much as you can about yourself, your body, what it runs on, how it works. Some of your genetics, we can't know everything, but there are some really cool tests available now. The more I find out and the more tests that have been made available, and just even the last few years, I've been able to figure out things about people that I really had no idea. And there's no really other known medical tests that I could have used to figure them out. For example, I when I did my gene test, I found out that I did not metabolize the B vitamin called riboflavin well. There is no test I would have ever known to do that would have told me that.
No.
So I think just the be proactive part and learn what you have. The other lesson I think I've learned most of all is that we just do live in a very toxic world. And if we treated toxins as something that, yeah, we're going to get exposed to them, but we should get rid of them. It's like going to get your teeth cleaned every 6 months and going to, whatever, get your facial every while, go and get your hair done. It should be a maintenance plan that everyone should be looking at. What toxins do they have and how can I get rid of them? Whether it's doing a sauna, whether it's checking for the heavy metals that we've all been exposed to. It's exercising and sweating. We can sweat out a lot of toxins. I think eating really good, healthy, organic, grass-fed animals and fruits and vegetables are also really important. Stay away from chemicals if we can, even the things we put on our skin.
Right.
Just look around at your world and make sure that you're not putting anything in your body that you're going to be sorry or that you're going to regret later. Because all these things, they add up. And I talked about that threshold. If we're eating a lot of bad stuff, it's not going to take long until we get to that level where something breaks. And this is where, if you find out where your threshold is, but you always live way lower than that,
sure,
we can handle this, but it takes work. It just takes work to be, like I said, proactive and know what your body needs, but take care of it. Right? Isn't that just a great lesson right now for this time? Like I said, it's what makes you healthy and staying healthy.
And a lot of people are just so unaware of what those toxins even are. Even the deodorant that I put on, I learned, has so many things that shouldn't be going into my body. So little things like that. And I'm so happy you bring it up because that is something that you could talk to your doctor about or go to the Born Clinic and really dissect and put your puzzle together. Along those same lines, my aunt, she's a pediatrician. And so growing up, she always told me, if I had something, somewhat embarrassing to talk about, to just tell her to put her doctor hat on. And, any family relation or judgment or whatever it was, I didn't have to worry about it. Just put your doctor hat on and we will just have a very frank conversation. So I want to know, what do you find yourself putting your doctor hat on for? Or in other words, what are women embarrassed to talk about that they really shouldn't be?
It's probably, for women, it's our hormone issues. Those hormones that because a lot of toxins will interfere with the proper functioning of hormones. But women are just sad to come in and say, man, I just am not the woman I used to be. I have lost my mojo. I just am not as happy as I should be. I'm not as good with my family. I don't want to get involved in my church and then my community groups anymore. And I hear that a lot. And it's disappointing that people feel this way. But once we balance our hormones and balance our internal environment better, it is such a joy to have someone come back and say, oh, I feel better. I'm sleeping better. My moods are better. Even that diet piece of this puzzle, there's so much research being done right now on the microbiome, and how healthy is your intestine. This just yesterday, I had someone come back and say, you got me on this great probiotic. You got rid of these bad bacterias. I've been eating healthy. All my anxiety went away. I have nothing. I am not staying awake at night. I have not had any panic attacks, and just little things. I mean, it didn't make that much of a difference to them. I mean, little, like I said, diet changes, nutritional changes. I didn't have to change a whole lot, but their brain started working better. Their thoughts were more organized. They didn't get worried about unnecessarily worrying things.
Mhm.
So that's fun. That's fun. It doesn't take much to get people healthy that way.
Wow, the power of your gut to control your mind.
The gut-brain connection is really, really important.
It's real. It's real.
It's very real.
Well, I will wrap this up with just asking one more COVID question, because I think a lot of people are just wondering, why are we having a stronger reaction or feeling sick after this second vaccine? What's going on?
Well, obviously, it's an immune system stress. Anytime we put anything in our body, it's stressful to get the virus. It's stressful to get the vaccine. And so that's just the fever and everything is just an immune system reaction to what you just put in your body. It's not, I mean, it's partly a predicted issue. Not everyone has a terrible reaction to it, but it's an inflammation reaction, and your body is trying to fight it. So
your body's doing the right thing if you're having a reaction.
Okay, it's maybe overreacting.
Okay.
But it's hard to predict which people are going to overreact to that or not. So
Back
it's
to what you were talking about. Mm-hmm.
Yeah. It's probably an overreaction, but we don't know. And it's hard to know how to undo that. But fortunately, it's not. It's likely not a lifelong problem. And if it's lasting, longer than a week or two, come on in. We can help modulate that inflammation response that you've had.
Awesome, and help figure out the puzzle. Everybody's so different. So yes. Well, thank you so much for inspiring us, Tammy. This was a very informative and inspirational conversation, so I really appreciate it. Always a pleasure to learn from you. And if you would like to learn more about the Born Clinic and how they may be able to help you on your journey to optimal health, go to bornclinic.com. This is Beyond the Fold. Until next time, cheers.